Welcome. In this session, we are going to look at the femoral triangle. By the end of this session, you should be able to state the boundaries of the femoral triangle and contents and some of the clinical correlations related with the femoral triangle. Welcome all. My name is Wallace Munyeri and I'm the Doctor. So let's start. So femoral triangle is a triangular depression on the front of the upper 1/3 of the thigh below the inguinal ligament. Its apex is usually directed downward and its boundaries are as follows. Its lateral boundary is the medial border of sartorius muscle. Remember, sartorius is the longest muscle in the body. Medial border is the medial border of adductor longus. So its lateral border is the medial border of sartorius and its medial border is the medial border of adductor longus muscle. Its base is the inguinal ligament and its apex is formed by the meeting point of the medial and lateral borders. That is the meeting point of the medial border of sartorius and the medial border of adductor longus muscle. So that is where the apex is. Its floor is usually gutter-shaped and muscular, and it is formed by the following muscles from lateral to medial. Iliacus is the most lateral. Then you have the tendon of psoas major, then pectineus, and adductor longus is the most medial. Then its roof is formed by the deep fascia of the thigh, the fascia lata, which has the saphenous opening. So saphenous opening is a modification of the fascia lata. So those are the boundaries. So I urge you to understand these boundaries very well. Then let's look at that. So these are the boundaries. This is its base, the inguinal ligament. Medial border is the medial border of its medial boundary. Let me say like that. Its medial boundary, the medial boundary of the femoral triangle is the medial border of adductor longus muscle. Its lateral boundary is the medial border of sartorius muscle. And these are the floor. This is most lateral, iliacus muscle, then psoas major tendon. These two, you'll find some text referred to these two as the iliopsoas muscle. These two will insert in your lesser trochanter, maybe for another day, that one. Then pectineus and adductor longus is the most medial. So let's continue and look at that in the cadaveric images. Here is your sartorius muscle, which is originating here at the anterior superior iliac spine. As you can see, it is running medially to go to insert into the via the pes anserinus at the upper medial aspect of tibia. So this is your sartorius. So its medial border here is the lateral border of this triangle. So you can see here. Then this is your adductor longus muscle. So its medial border, which is somewhere there, that is the medial border of a medial boundary of femoral triangle. And here we have the inguinal ligament here. So this triangle, which I'm trying to mark out, that is your femoral triangle. And you can see here is iliacus muscle, which forms part of the floor. The most lateral muscle forming the floor of the femoral triangle. Here we have cut the sartorius and deflected it to show you this muscle clearly, the iliacus. You can see like here they are calling it iliopsoas muscle, but this is the iliacus muscle, and you can see here is a tendon, the psoas major tendon, but some text as I had said earlier, defined as iliopsoas. Then here you can see your pectineus muscle. Here you can see your adductor longus, and deep to adductor longus is your adductor brevis. So then here you can see the rectus femoris. Those are muscles of the anterior thigh, which by now I believe you might have looked. If you haven't, I will do a video on that. And then let's continue. Now the contents of the femoral triangle. Now The main contents are as follows: the femoral artery and its branches, the femoral vein, the femoral nerve, deep inguinal lymph nodes, and the lateral cutaneous nerve of the thigh, or the lateral femoral cutaneous nerve. Then in addition to those structures, you will also have the femoral branch of genitofemoral nerve and the fibrofatty tissue. Obviously, you find fibrofatty tissue in most anatomical spaces. So let's look at them. Now here we are. Now this is the lateral femoral cutaneous nerve, that one. Then here we have the femoral nerve. This is from lateral. This is lateral. This is medial. So most lateral is this lateral cutaneous nerve of the thigh. Then femoral nerve. Then femoral artery. Then femoral vein. Then we have the inguinal lymph nodes. So we start with the nerve, the artery, the vein, and the lymphatics, the lymph nodes, that is. So please understand this arrangement. The relation here is very important. This is very important because we look why. But I want you to imagine a situation where you want to draw back to draw blood from the femoral vein. Then you will palpate the patient's femoral triangle, you feel the pulsation. So you should move medial to obtain the blood from the femoral vein. But if you haven't understood this anatomy, I want you to imagine what damage you can do to that patient if you pierce the lateral side of the femoral artery. That is very dangerous and can lead to paralysis of the quadriceps femoris. So please understand this arrangement. So let's look at the femoral sheath. Now maybe I go back here. Now these contents, these femoral vessels, the femoral vessels as they are here up is the abdomen. As they exit the abdomen, as they pass below the inguinal ligament, they usually draw a fascia which it is funnel shaped, which encloses them. That is that funnel shaped fascia that encloses them is now what I'm calling the femoral sheath. Now it is a funnel shaped fascial sheath enclosing the upper 3 or 4 centimeters of the femoral vessels. The femoral sheath is divided into 3 compartments. It has a lateral, intermediate, and medial by 2 antero-posterior septa. Now this femoral sheath, the lateral compartment will contain your femoral artery and the femoral branch of genitofemoral nerve. The intermediate compartment will only contain the femoral vein, but the medial compartment is small and it is also known as the femoral canal. Maybe an image will help you with that. You can see here, this is the femoral sheath. Now, the femoral vessels passing beneath the inguinal ligament, they usually draw around themselves a funnel-shaped prolongation of transversalis fascia. So this anterior lamina, if I might call it like that, is a prolongation of the fascia transversalis of the abdomen, and the posterior one is a prolongation of the psoas fascia. So this is the femoral sheath, and you can see here. Now this image here is like we have taken this diagram and cut it like this. Then we view from above. You can see lateral, the most lateral, we have the femoral artery and the femoral branch of genitofemoral nerve. Then intermediate compartment, we have only the femoral vein, and the most medial compartment, also known as the femoral canal, we have the lymph node of Croquet. This lymph node is also known as the lymph node of Rosenmuller, or the lymph node of Croquet. And this lymph node is very important because lymph, it usually drains, it receives afferent lymphatics draining the glans penis and the clitoris. So if you have cancer of the glans penis or the clitoris. Glans penis is is in males and the clitoris is females. If you have let's say cancer, the cancer cell will first metastasize to this lymph node. So this, if a patient has cancer of the clitoris or the glans penis, this lymph node must be also removed. Now the femoral artery. The femoral artery traverses the femoral triangle from the midpoint of its base to the apex, and the artery passes downward and medially. As a result, at the base of the triangle, it lies lateral to the femoral vein, but at the apex, it lies anterior to the vein. Then the femoral artery gives 3 superficial branches. These are the branches of the femoral artery, the femoral triangle: superficial epigastric, superficial circumflex iliac artery, superficial external pudendal artery, and also gives 2 deep branches: the profunda femoris or the deep femoris artery and the deep external pudendal artery. Maybe when I will be looking at the course of femoral artery, we will look at this keenly. Then profunda femoris is the largest branch of the femoral artery. Now let's look at the femoral vein. The femoral vein is the upward continuation of the popliteal vein at the adductor hiatus. Remember, the adductor hiatus is an opening at in the adductor magnus muscle. So when the popliteal vein closes that opening, it becomes the femoral vein, and then it will traverse the adductor canal, also known as the Hunter's canal, also known as the subsartorial canal. We'll be looking at that also in another video. Then after ascending, it enters the femoral triangle from its apex, and then where after traversing the intermediate compartment of the femoral sheath, it continues as the external iliac vein. So after crossing the inguinal ligament, it changes its name now from the femoral vein into the external iliac vein. So tributaries. Now, it has several tributaries, but this is one of the most important: great saphenous vein. It also have profunda femoris vein drains into it, medial and lateral circumflex femoral veins drain into it, deep external pudendal, and direct muscular tributaries. So those are the tributaries of the femoral vein. Now let's look at the femoral nerve. Femoral nerve, remember I said, if you have been watching my videos, I said its root values are the dorsal divisions of L2, L3, L4. So it is the chief nerve of what am I saying? It is the chief nerve of the anterior compartment of the thigh. It is the largest branch of the lumbar plexus and arises from the dorsal divisions of the anterior primary rami of L2, L3, L4 nerves. Then it enters the thigh posterior to the inguinal ligament, lying lateral to the femoral sheath. So femoral nerve is not a content of the femoral sheath. Only the femoral vessels are contents of the femoral sheath and the femoral branch of genitofemoral nerve. So mark that point. About 2 centimeters below the inguinal ligament, it is divided into anterior and posterior divisions, which are usually separated by this branch from the femoral artery, the lateral, not from the femoral artery, sorry, but from the profunda femoris artery, the lateral circumflex femoral artery. So anterior division will give off 2 cutaneous branches and 1 muscular branch, which include the cutaneous nerves, include the medial cutaneous nerve of the thigh and the intermediate cutaneous nerve of the thigh, where the muscular branch is the nerve 2 sartorius. The posterior division will give 1 cutaneous branch, which is known as saphenous nerve, which will supply the medial aspect of the leg and some part of the foot. Then, and also gives off 4 muscular branches to supply the quadriceps femoris. Remember, quadriceps femoris are 4 muscles: the vastus lateralis, vastus intermedius, vastus medialis and rectus femoris. So those muscles are supplied from the posterior division. Here it is, you can see L2, L3, L4, these are the dorsal division of the anterior primary rami. This is the main trunk of the nerve. Then from the main trunk, it will supply iliacus muscle and pectineus. Then here it will divide into, I think this is the posterior division. This is the anterior division, which will give only one muscular branch to sartorius and two cutaneous nerve, the medial and the intermediate cutaneous nerves of the thigh. Then the posterior division will give off only one cutaneous nerve, the saphenous nerve, and give off four muscular branches to the rectus femoris, the quadriceps femoris, that is rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. It will also give, I think, one to the articularis genu muscle. It also gives an articular branch to the knee joint, and it also gives an articular branch to the hip joint. So here we are. You can see now this is here is the femoral artery. Here it is. You can see this is your femoral vein. You can see it is line medial. Then here you can see the termination of the great saphenous vein. Then here you can see the femoral nerve. Okay. Then this is your sartorius, which you have retracted, adductor longus there, pectineus there. Here you can see the superficial circumflex iliac. Superficial circumflex iliac artery. Okay. Then from here, you can see it, even as it runs here after removing. Here we have removed the sartorius muscle. You can see now here it is running in the adductor canal, and here is the adductor hiatus. After passing here, it will become the popliteal artery. Then here you can see we have the femoral nerve, and it is divided into two divisions. Yeah, there's these two divisions. They are usually separated by the lateral circumflex femoral artery, branch from the profunda femoris artery. Okay, those ones you have seen. And then the same here. You can see the same we are doing here. Anything new here? Don't think there is anything new. This image and the last one, they are almost the same. I want you to just familiarize yourself with these images, because these images will prove very, very important. Okay. This is your lateral femoral cutaneous nerve. This is your sartorius muscle. This muscle here. And here you can see this is the intermediate, and this is the medial cutaneous nerve of the thigh. This is your great saphenous. So your great saphenous vein, and you can see it is draining into the femoral vein here. Okay, this is the femoral. So vein, most medial, then artery, then this must be a femoral nerve, then inguinal ligament there. Okay. Okay. So some clinical correlations related to that anatomy is that compression and palpation and cannulation of the femoral artery. Now, the femoral artery can be compressed against the femoral head at the mid-inguinal point to control bleeding in the distal part of the limb. Now, imagine a situation where a patient, let's say, is involved in an accident, and maybe the leg has been fractured and there is profuse bleeding. So you need to stop this bleeding. You can compress the femoral artery at the level of femoral triangle against the femoral head to control that bleeding. Also, pulsation of the femoral artery can be felt by the clinicians in the femoral triangle just below the mid-inguinal point. Since the femoral artery is quite superficial in the femoral triangle, it is the preferred site for cannulation and injecting dye to perform procedures such as angiography. Now, it is also the preferred vessel for performing coronary angiography and angioplasty. These terms, you will read them. These are some clinical things which you do later in your practice. Now, let's look at puncture and cannulation of femoral vein. Now, this will prove very important. The femoral vein is the preferred vein for intravenous infusions in infants and children and in patients with peripheral circulatory failure. Now, the femoral vein is used for inserting a catheter into the right atrial chamber and right ventricle to collect blood sample or to record pressure or to reach the pulmonary arteries. Let's say you want to reach the pulmonary artery. So you will insert a catheter into the femoral vein, then you will push it, and you will push it. It will go through the external iliac vein, then to the common iliac, then into the inferior vena cava, then into your right atrium, then into your right ventricle. Now, then, if you want it to go to the pulmonary artery, it will go then through the pulmonary trunk, then into the pulmonary artery, the one you want. So that is how you do cannulation of the that. That is why that anatomy is important, because when you need, as a clinician, you need first to identify the location of the femoral artery, then medial to it is where the femoral vein is, not lateral. Lateral to it is the femoral nerve. So thank you guys for your attention, and subscribe for more anatomy and biochemistry content. Thank you.